Respected teachers and learned audience from home and abroad. Very good morning. This is Dr. Ismail Chico. Now, I'll be talking on the last chapter of neurosurgery. This is mentioned by Professor Atul Goel, the AVM. The AVM is a complex intravascular disease, complex malformation, and according to Professor Goel, it is called last chapter of neurosurgery. And AVM surgery is a dream for many enthusiastic neurosurgeons like me. So for the surgeons, AVM is both a challenge and the test of precision, courage, and corridor. So my talk on the microsurgical excision of high-grade pial arteriovenous malformation, our experiences. So I'm working in the Dhaka Medical College Hospital. This is my mentor, Professor Aziul Haq. So we know the AVM is a tangle of blood vessels that directly flow from arteries to vein with intervening nidus instead of through the capillaries. So we know very well about the grading system of the AVM, that is Spezler-Martin grading system. It has 5 points, and the Young-Lawton grading system also have 5 points. So if we combine these two grading systems, both Young-Lawton and Spezler-Martin, then we'll get the supplemented Spezler-Martin grading system. So its grading is between 2 to 10. The low grade is 2 to 4, intermediate grade is 5 to 7, and high grade is 8 to 10. So what literature said, Mr. Kim and his team published an article that is a validation of the supplemented Spezler-Martin grading system for brain arteriovenous malformation in a multi-center cohort study of 1,009 surgical patients. What they mentioned? They mentioned the boundary of AVM operability. The supplementary Spezler-Martin grade 6 is a cutoff or boundary of AVM operability, because less than 6 or less than 6 grade has low surgical risk and high grade has higher surgical risk. But and it is published in 2015. So till the 2015, it was the boundary. So supplemented Spezler-Martin grade 6 was the boundary. But in 2021, in the Journal of Neurosurgery, JNS article, this is published by Mr. Catapano and Michael Lawton. This team showed that supplemented Spezler-Martin grading system has a cutoff value is 6, but some young patients with small nidus in the low risk supplementary Spezler-Martin grade 7 group have favorable postoperative outcomes. So they mentioned that the operability boundary is a hard limit reflecting the complexity of high grade AVMs. So I am talking about this, how we operated some high-grade AVMs. So in the last 6 years, we operated 15 cases, all have supplementary Spezler grading high, that is 8 or above. 2 patients are infratentorial, 13 patients are supratentorial, all underwent microsurgery without prior embolization because of patients' affordability. 2 patients are dead, and rest of the patients had good modified Rankin scale outcome. This is our first case. Mr. Rafi, he was 25 years old. The Spezler-Martin grading showing this lesion is size is 3 and is drained into the deep venous system, so V1, but it is non-eloquent, so E0, that is Spezler-Martin grading is 4. But Young-Lawton, as age is 25, A2, it didn't bleed, so B1, and it is not compact, it is a bit diffuse, so 4. So supplemented Spezler-Martin grade combinedly is 8. So we approached this patient through the middle temporal gyrus, and luckily we have been, it has been possible to total excision of the lesion. So this is the pre-op and post-op comparison of the image. This is the coronal section. So there is no residual lesion and as well as no abnormal venous system. This is the comparison of angiogram. It was fed by right PCA and right MCA, both have been clipped. You can see the postoperative. You can see the laser is not working. Okay. So what about the patient? The patient has only the contralateral superior quadrantopia. Otherwise, he is dealing his activities normally. So these are our AVM team. So our another case, this patient is older patient, that's 65 years old. So young Norton A3 and it bleeds, so B0, but it was diffuse. So young Norton grade came 4, but spatial Martin grading is S3 as it is drained into the superficial venous system. No draining, no deep venous system drainage, but it is located in the elongate brain. So spatial Martin grade 4, so supplemented grade is came 8. So we approach through the large frontoparietal craniotomy, and we excise this lesion. Total excision have been achieved. So pre-op and post-op comparison showed there is no residual lesion. This is the coronal view, sagittal view. You can nicely appreciate the deep venous system now well functioning. And this is the perioperative picture. This surgery is done 4 years back, and this is her follow-up video. And patient has no neurological deficit. This is another giant AVM. This spatial Martin grade came 4, young Lawton 4, and combined supplemented spatial Martin grade came 8. So we also approached this patient. Microsurgical excision done. This is the perioperative picture. This is the giant. This is the draining vein, and this is the normal draining vein. You have to identify which is the draining vein of the AVM and which is the normal draining vein. And this is the excised part of the AVM. This is the postoperative angiogram showing there is no residual AVM. This is the another comparison slide. So what about the patient? This patient has hemiparesis just after surgery, but after 3 months, hemiparesis improved, but still have some weakness. Hopefully, he will improve more further. So, this is very unfortunate case because this is also spatial Martin grade 9. Patient has breakthrough bleeding postoperative, and we have lost this patient. These are another case. This is a small AVM, not large, not medium size AVM, but this location is in the center of the brain, and age of the patient was 43. So young Lawton it came 5, spatial Martin grade came 3. So it is also high grade AVM, and we approached the interhemispheric approach. Total excision acid. This is the comparison image. So this is the patient in the postoperative. Patient was being measured. So these successful surgeries were not just surgical. It was emotional, and it reminded us why we choose this path. Not for titles, not for recognition, but for the chance to make a real difference when it matters most. Thank you very much for the attention.